Good morning, everybody, and thank you very much again for joining us on this webinar. Absolutely delighted that so many of you do take the time to join in and feed to us the issues that you want to hear about or the things that are on your mind. So really, really grateful for you doing that. Can I just introduce Jackie, who is also with me, socially distanced, actually in another room. Good morning, Jackie. Thanks very much for joining us. Obviously going to ask Jackie to comment on some of the issues that you already raised with us. We've had a few questions in advance, or any that come up during the time that we're on the call. So what I thought I would do is just kick off as usual with a very, very short update, and then we'll go into answering some of the questions. As I said, we've had some in advance. This is the first time that we've done the webinar using Microsoft Teams. So if it all goes horribly wrong, please be very, very forgiving, because I and those around me, we're all having to get used to the technology, and I'm pretty confident there's going to be a glitch somewhere or another. So please just forgive us. Gradually we'll get a bit better at it, I'm sure. In terms of a general update, I'm not going to repeat the things that I've said other times, other than the thank you. I can't say that enough, and it always seems particularly pertinent when we're doing these webinars on a Thursday, and it's the day when we all go out and clap in the evening. I know when I go out and clap, I'm thinking about you all, but you're very much in my mind. So let me just, in advance of 8 p.m, just give you my clap and say thank you so much for all that you do, and for the sacrifices that you make to be able to keep providing the services to our service users. It is hugely appreciated. Just a couple of other things from me. You can't possibly have missed the fact that we are anticipating an announcement at the weekend from the Prime Minister regarding some form of easing of the lockdown. Obviously the review is today, but I think it's been fairly well trailed that we're not going to hear any details until Sunday. I don't have any inside information on what that's going to say, so if you were hoping for that, sorry to disappoint you, but obviously we'll be watching very closely. I think what we can anticipate is that there is going to need to be continued social monitoring and caution in the way that we all work and live for some time to come. So whatever the easing, I don't think that message is going to change. And just to let you know that what we have already started doing, and I hope many of you have heard about this, is we're doing a quick audit of all our spaces, clinical and non-clinical, just so that we can identify now where it's relatively easy for people to work and still be socially distant, and where it is really tricky. And obviously we want to add into that thinking where we can continue to work from home, so that eases the number of people in any one space, and where for some reason that's a bit more difficult. So once we've done that audit, we'll really be applying our minds to solving the problems where we have issues, where we know it's tricky. And the sorts of places that we might think about are some of our wards, where perhaps getting the space in the nurses' station is really going to be a little bit tricky, and we're going to have to come up with some solutions. So that is underway, and we are also well into what's being called the recovery phase, I think, and submitting plans now in terms of how we can start to open up some of the services that perhaps we had reduced or indeed closed, and we're starting to give that quite a lot of thought, and what the priorities are for opening up more services as we start to see more referrals coming in. And you've probably noticed that the activity is starting to come back a little bit. I'm not going to say any more because I think it's more important that you get the airtime than I do, but I would ask, if you want more information on something that you feel we're not giving you enough of, will you please tell us, because then we can address that either through the webinar or through other information that we put out on the daily updates. So just one more thing I want to say, which is it's really come to my attention today that there are risks about our technology, and the risks of people having cyber attacks or being hacked. So I just want to take this opportunity, given that it's really uppermost in my own mind today. We hear one of our neighbouring trusts had quite a bad experience of some hacking that was done through a virtual group that they were running. So can I please ask everybody to be incredibly aware of that. First of all, any suspicious emails, anything that looks a little odd, just ignore it. I do. My team will tell you. I was saying this morning, if I spot something that just doesn't look right, then I ignore it. I just think, well, they'll come back, won't they? If it's real, somebody will find another way of getting hold of me. Be really careful about anything in your private life as well as in the work that you're doing here. And we will be putting out some messages today about Zoom and some of the particular concerns about that. So please watch out for that. We just have to be able to be absolutely certain we can protect everybody when we're using these technologies. Okay, I'm going to go straight onto the questions now, and I'm going to ask Jackie to kick us off, because I think she has some comments that she might like to make around the recovery phase or anything else that's particularly on her mind, and then I'm going to take some of the specific questions that have come through.
Yes, thanks very much, Angela, and hello everyone. Welcome to this really important session that we have every Thursday, and as Angela said, Thursday is a particularly special day because we all do our clapping in the evening, and you were always in my mind. But there's been a very nice thought suggested by a member of staff who said, would we encourage people to have a virtual tea or coffee catch-up with colleagues who are working from home? I think that's a great idea. There was a lot of excitement about working from home and a great novelty that it is, but it can be incredibly lonely. And if you know a colleague is working from home and they're looking after their children, then give them a call, give them a ring, give them a call on something that's safe, and have a catch up with them. I think that would be so valuable because it can be incredibly lonely. And Angela's mentioned the recovery phase, and I know the executive team are working really hard on how we do that in a safe way. So how we get services up and running again while still protecting staff and service users from COVID-19. That's an enormous challenge, but we've got some fantastic people in this trust who are thinking that through. Any suggestions that you have, I know Angela and the team will be very willing to hear them. So that's all from me at the moment, Angela. Thanks very much.
Thanks, Jackie. Okay, let me take a couple of the questions that you've submitted in advance. And meanwhile, now is the time to get your other questions in. So do please start submitting them. Use that ask a question icon that you've got on the bottom of your screen. And as we've done in previous webinars, if we can answer it live, we will. If we don't get to your question for some reason, please don't worry. I promise we will record it on the questions that then go out subsequently on the intranet. And if there's any questions I can't answer, we'll add in the answers. We'll go and find them and put the answers in. And likewise, with any questions we don't actually get to, we'll put the answer on that report. So everything will get an answer eventually. So somebody's asked the question about whether all of our wards have been converted back to normal now. Sid put that question in. Thank you very much for that. And the answer is no, not quite. First of all, one of our wards remains the ward that we are using for any patients who we either suspect have got COVID or who have had a confirmed test. That's Sapphire Ward. So if you remember, that used to be our assessment ward, and that's definitely been the ward where they've built up that kind of expertise and confidence in looking after people whose physical health needs quite a bit more attention, and where they've been nursing people with COVID. So we have kept that ward at the moment designated in that way. It is something we are constantly reviewing. As you would expect, as the numbers get small, we have to start to think about whether that's realistic to kind of keep that whole ward available for COVID positive patients. So constantly under review. And Rosewood Ward is still not reopened, but we are very much expecting to open that within the coming week. Obviously, that's been dependent both on need, as needs have gone up. As you know, we've started to open up some of the previously closed wards, and also staffing. It's absolutely imperative we have safe staffing, and I'm sure some of you are aware some of our wards have had some really high acuity in the last week, and so keeping the level of staffing that they need has been uppermost in our minds, even whilst we've been grappling with how we get the staffing together, potentially to reopen another ward. Somebody has asked for an update on staff testing. I won't go into too much detail because I think we've covered this before, but we will make sure we put it out in the written response. You'll know that the government's intention is to get more and more testing available, and certainly we are testing service users now as they come in, if they're admitted, and we are testing any service user that goes into either a care home or a community bedded unit, so somewhere where there were lots of other people in a sort of residential environment. So likewise with staffing, we are getting far more tests. If you're asymptomatic, there is the kind of the government website where you can book yourself a test if you have a member of your family, for example, and who's positive and you want to know, or has got symptoms and you want to know whether you're positive, you can use that website. And we've continued to get the testing arrangements for symptomatic staff at UCLH or at the Whittington, and all the details about how to access those are in the resource library. So do go there if you've got any questions. Somebody has asked the specific question about how to support people to come back to work whilst reassuring people about social distancing. I think in some ways I've said probably what I need to say in terms of the work that we're doing. So we're just assessing where that's relatively easy, and we can say to people, here's the arrangement, you know, we've assessed your space, half of you are going to work at home for some certain days, half the other days, this is how it's all going to work. We're doing all that thinking now, and we're thinking hard at making sure we've got the information on those areas where it's trickier, so that we can think about how to resolve that. So I may have more to say next week on the webinar, but let me hand over to Jackie and see if Jackie has any comments to make about that.
Yeah, sure. Thanks very much, Angela. Well, I think if people need reassurance, then please step forward. This is something that Angela has said every week. And if you've got anxieties, if you've got concerns, if you have underlying conditions, then please step forward. I think the audit that's happening at the moment is terribly important to try and make sure that the environment can be as safe as possible. But tell us if you've got those concerns, and then we can respond. That's the most beneficial thing you could do, and it helps us try and work with you to see what will work best. Thanks, Angela.
Thanks, Jackie. This came up a little bit last week, this next question. Somebody asked what's being done to support staff that are working from home. And I think they meant particularly the kind of practical things that you need to be able to do that successfully. So IT equipment and possibly having the right chair and so on. So certainly in terms of IT equipment, I think we talked about this quite a lot last week. If it is still an issue, please let my lovely comms team know. And what we can do is perhaps have the next webinar invite Jeff Boateng to join us and have a webinar that's a bit more dedicated onto those issues. So I'm in your hands. If that's something you'd find useful, you know how to vote. Just let us know if that would be something that would be of interest. We have continued to order more and more equipment, more and more laptops, and I know that because I've seen various people who've contacted me directly. I've redirected them to Jeff, and I've seen their issues get resolved, and the prioritisation work, particularly when those have been clinical staff who've really needed that equipment to be able to work effectively. So I'm pretty sure that IT ongoing programme of getting all the equipment that we need, and obviously it was a huge increase, that is well underway, and if there are any people remaining waiting for things, I'm sure that you're known about and that is in hand, but we'll get the update from Jeff next week. In terms of if somebody really had other issues, that they just didn't have the right chair and it was creating back problems or something, this isn't something that's come to me until now, but I would just suggest that you let us know. I mean, bring it up through your manager and let's see what we can do to help, because I think if the question probably will be, do we anticipate you being one of those people that's going to very quickly come back into work, in which case probably that's the solution, or not. And if it looks as if longer term you're going to be required, or your own situation requires you to work from home, then obviously we need to work with you to see how we can resolve that, and I would want us to do that to make sure that you can work in a safe and comfortable way. So please do raise that either through HR or with your manager, or if all of that fails, come directly through to me and I'll try and redirect your query. There's a question that's come through live. Let me take a live one for a minute, and then I'll go back to my list of previous questions. So somebody has asked if these webinars can happen on different days each week, as some people don't work on certain days. And Joe, you've helpfully asked that question. Thanks for raising it. I think we have tried to alternate the days, and I don't think we've always done them on Thursdays, but I have a feeling this might be the second one we've done in a row on a Thursday. So we will take that on board, and let's make sure that we do a different day next week and make sure that it is, we try and vary the times a little bit as well. But if there is a preferred time of the day, please let us know. But we will try and keep rotating the times that we hold them. So that everybody gets a chance to join in. Let me take another question. Actually, I'm going to take a question that was a bit painful, if I'm honest, to read this morning. So somebody has said that it feels as if perhaps the executive team are a little bit detached from what it's really like on the ground. I'm really sorry to hear that. Somebody even said that I sounded a bit like a politician, which grieved me terribly. I cannot think of a worse insult that could possibly have been directed at me. I shall have to go and have a strong cup of coffee after this to recover. So I'm really sorry if that's how I sound. It's definitely not how I want to come across. And I think as a team, we have tried really hard to keep in touch with everybody and to find out kind of what are the issues, what's on your mind, what's troubling you, what do we need to be paying attention to. So if somebody out there feels that we've missed that, then first of all, genuine apology from me, but also please speak up. So the things that we've been doing, a number of my colleagues, clinical colleagues, have been going around and visiting certainly the wards and some of the other teams and talking to people directly. I have curtailed my visits because I've felt that wasn't the right kind of message really, when we're not allowing visitors and other people to come in and out. It didn't feel quite right. But I have now asked if I can visit virtually. So you will be seeing that I will be asking to join you in your team meetings, which is, as you know, in the past has been a great way for me to hear firsthand from you about the things that you're really proud of and the things that are troubling you, and has often really helped me then work out things that we need to do and pay attention to. So I'm going to start those up again, and my colleagues will also be doing the same. So if whoever it is that put this question in, if you want me to visit your team, the door is open. Just ask me and I will be there, albeit at the end of an iPad, but I'll be there. And I know my colleagues would say the same, and I've no doubt that Jackie would be equally happy if you want to invite her to your meeting virtually. Jackie, you might want to say something.
Yes, thank you. And I was interested in this question as well, and I can understand why you feel the way you do about it, Angela. It's really hard for anyone to step into the shoes of healthcare workers in the front line. We all see the stories on the news, and they are heartbreaking to look at how people are suffering in care homes, in hospitals, in the community. But I think what we can do in positions of seniority, and I use that term just for the purposes of this question, is listen. And if we're not listening, if you feel we're not listening to your concerns, we're not responding to your concerns, then tell us. The webinar is one way of doing that, but there are many other ways in which it can be done. And as chair of the board, what we're doing is hearing from Angela every week, who gives us a very detailed update on all the issues surrounding the virus and how services are managing and how staff are coping. So we get first-hand knowledge from her, but there are other ways in which you can tell us what it's like and how it feels for you. So what I would say is please continue to do that, because the only way we can do anything about it is by hearing from you. We would love to come and visit and thank you personally, but social distancing and safety of service users and our staff is the highest priority, and we can't do that. So please use every channel available to you to let us know what's on your mind. Thanks, Angela.
Thanks, Jackie. I've got a couple of other questions that have come in while we've been on the call. one of them is not really a question, it's a comment, and it's a nice comment, so let's take that. So someone has just said a thank you for the letter that went out for children with the rainbow that they could colour, and she's saying that she sent this to this person sent this to their 8-year-old granddaughter. This is from Gillian, who was absolutely delighted. So that's just a positive. I've sent it to my grandchildren, Gillian, and I haven't had a response from them, so they're in trouble, and I will be on to them very soon. But yeah, it was a great idea, and I know we had lots of people who really appreciated it. Somebody has raised the issue about teams being concerned about the increased numbers of service users waiting lists for assessments, and asked whether there'll be additional resources dedicated to reducing those. So I can't give you an exact answer to this question, but what I can tell you is that there is some, all the work that we're doing locally on recovery that I've just described, starting to think about where are the priorities, and when I say we're thinking about it, I don't mean the executive team are thinking about it on their own. I mean, we have asked people in the services, in each of the divisions, to think and to then come back to us and say, these are where we think the real priorities to open up and do something are. So we are gathering that information that's coming from you, from your teams, and then we'll put that together so that we can start to think about, as we get more staffing coming back from being off unwell, we'll know where we can most importantly start to open up services and how we should do that. So that's the first thing to say. The second thing to say is, obviously this work is also being led nationally, and I am very privileged to have been asked to sit on the working group, the national working group for mental health, for thinking about the recovery. We had our first meeting this week, and top of the agenda to think about was money, was kind of, is there going to be some sustained money that will enable us to actually provide more in terms of mental health support, as you rightly say in this question, possibly for those people who have been waiting, possibly for increased demand that we might see in some groups. I don't have the answer to that question, but I promise you we made a very clear request in terms of what we thought we would need, where we thought the kind of imperative was for additional resources to be available for some time, and I will continue to feed back to you what I'm allowed to feedback from that group. But I am expecting that whilst we won't get a blank check, that we will get some kind of sustained resourcing that allows us to do some of the things that we have seen have worked well, and some of the areas where we know we need to do more as we start, as more activity starts to come back. The only other thing I would say about this question goes back to that recovery work. If you feel that's a priority area that you're worrying about, it's absolutely imperative that we know about that as we put our recovery plan together. So please talk to your team leader and make sure that that is part of the response that you've given us. So you've said really clearly, absolutely, number one priority has got to be this group of people, so that we can then start to think about how we open up increased services as we find out how much money we're going to be able to continue spending going forward. I think I've got time for one more question. I'm looking at my comms team just to see what they say. So somebody has said that, I think this is possibly the same person that raised the question last week, says that they continue to be concerned about bullying, and that they feel that they're not getting anywhere with management. Can I please ask that person to either contact Jackie or myself urgently? So I don't think Jackie and I could have been clearer last week. We will not tolerate bullying. I won't tolerate it. I know Jackie won't tolerate it. If you are really anxious about this and you are trying to raise it and nothing's happening, please email directly. We're easy to find, and speak to one of us about it by email so that we can find out what's going on and give you some support. Jackie, is there any more you'd like to say about that?
Yes, Angela, thanks for raising that. And whoever this person is, thank you again for having the courage to step forward with this. As Angela says, please just contact us. Contact Angela, contact myself anytime, and we will speak to you. It doesn't matter, we will speak to you. Bullying is unacceptable on any level, at any time of the day or night. We can't accept it. So please do step forward, tell us who you are, tell us what we can, where the problem is, and we will sort it out. Thank you.
Okay, I think we're coming to the end. I've got two final questions, neither of which can I give a great answer to, so I'm apologising in advance. The first question is a nice techie question for a very non-techie person, and says, what's the real problem with RAS? Well, I know that this is above my pay grade, so I can't give the answer to that question, but I promise you I will get somebody who does know the answer to that question to put together the answer and to get a nice, clear, plain English response out when we put the report out of this webinar today. So thank you for raising it. I know people are concerned about the technology and about some of the systems that have been a bit shaky over the last week. And I will absolutely make sure that we get you a response, not only about what's the problem, but what are we trying to do about it. So apologies that I can't give you a better answer here and now. And somebody has asked whether people will get a bonus as we start to, presumably they mean as we start to come out of this this period of time. I have to tell you that if it was within my gift, I would give every single one of you a huge bonus, because I think you're all worth it and more. But unfortunately, it is not within my gift. I have to work within the kind of the rules of the public sector, just like anybody else does. And at the moment, there is no indication from the centre that there is going to be such an arrangement for NHS staff, but I promise you that should that position change, then you will be the first to know. I will shout it loudly from the rooftops, but at the moment, sadly, there isn't any arrangement of that kind that we're being informed about. So I'm going to wrap up now and say thank you very, very much. Thank you for your questions. It's great to have them come in. You heard me say at the beginning, if there's something you wanted to talk about next week, give us advance notice, particularly if it's something like IT, and we'll make sure we've got the right person there so that we can give you the answers rather than me just having to say I'll go and find out. So please tell us what would be helpful for you. Thank you again for all of your support, and I'm going to hand over to Jackie for the last word.
Yes, thanks, Angela, and thanks to everybody for your questions. It's great. Thank you for taking the time out to ask us and to share your concerns. My heartfelt thanks, as ever, to all of you. I don't know if you know, but I'm on Twitter. I'm a bit of a social media fanatic, and I am always tweeting about how wonderful the staff are at CNI, and I cannot tell you how proud I am of the work that you do. So thank you from me. And we look forward to next week's webinar. Thanks very much, everybody.
Thanks, everyone. Bye.